I'm a consultant for the EuFMD Commission, and I am a veterinary epidemiologist. But I've had the pleasure and the luck to have worked for farmers for quite a long time. For many years, I was a veterinary advisor for both the Belgian and also the World Farmers Organization. And having worked for those people gave a new perspective for me to animal disease control. And therefore, I always tend, in my talks, to take the word of the farmers into it. And I think it's giving an additional perspective to how to control foot and mouth disease in the future. And we're going to talk about what if we could give farmers and cooperatives access to vaccines. Before I continue, I have to acknowledge a number of people which actually gave input to my talk and gave ideas and gave statements. And it's people from the industry, from the OIE, also from the International Dairy Federation, and you will notice that, unfortunately, there's no farmers organization in that list. Actually, so I asked them to give their opinions, and they didn't. Both the European and the World Farmers Organization, they didn't reply, not in time, which again maybe highlights that maybe foot and mouth disease is not always farmers are not always aware of the risk and the potential impact of foot and mouth disease on their business. What's the problem with foot and mouth disease? These are estimates about 1.8 billion domestic large ruminants in the world. Of these, there's 800 million living in FMD-free areas, but the majority is still living in, having their life in FMD-infected areas, 1 billion, and nearly 700 million are never vaccinated. So the majority of the animals living in FMD-infected areas are never vaccinated, and this leads to an estimate of 250 million cases, FMD cases per year, which is a very large amount, and which makes that it's really an issue to make progress in controlling FMD if these figures keep appearing, meaning that apparently there's a lack of capacity to have a sufficient amount of vaccine distributed to the animals, to the farmers. And so the global spread of FMD is not yet under control, and there's different reasons for that. There's the strains which are changing. FMD is a very, very infective disease, of course. Farmers will not always notify when they have disease on their farm for several reasons. And also one of the reasons is that there's a limited and uncertain access by farmers, by field veterinarians, by cooperatives to the vaccine. And it makes that in most of FMD-infected countries, these countries will remain on if you go to the progressive control pathway, they will stay stuck at level 1, level 2, and have it very difficult to move forward further into that in that pathway to level 3 or further on. It's about responsibilities. FMD is a disease which is actually directed by the OIE and also the World Trade Organization. Those are the two international bodies which direct member states to controlling FMD, and therefore the member states, the governments, are held responsible and feel responsible also to control FMD in their country. And controlling foot and mouth disease means in infected countries that they have to be able to eradicate outbreaks, but also to assure that there are sufficient amounts of FMD vaccine available, and they are distributed to the farmers. And by the fact that individual countries, member states, take the responsibility of controlling FMD, there's very little engagement by farmers in the control of FMD, because they always think that it's the responsibility of the government to take care of that for them. And they will often blame, if they have an outbreak, if their herd gets infected with FMD, they will often blame the government for not doing a good job, not having enough vaccine available, not supplying the vaccine, not having animals vaccinated and all that, not have good quality vaccine. There's several reasons which are maybe true or not. But so the owners will very often say, well, it's the responsibility of the government and it's their mistake if things don't happen. But with the fact that they consider the government to be responsible for the control, they ignore, and they tend to ignore, that FMD has a high economic impact on their livelihood. If you have a farm somewhere in an FMD-infected area and the disease is introduced, and a farm has like 5 animals, after the infection he will only have 1 or 2 left, and it has a very high impact. And they sometimes do not tend to value that as a risk. So from a farmer's perspective, it might be a good idea to invest in FMD control by themselves, and an investment would be giving a good return of investment and increase the livelihood and the economic viability of their farm. Only if it's only a farm with a few, if they're smallholds, and only if it has a few animals. But that's an approach which is very seldom seen in those areas. Not only in FMD-infected areas, also in FMD-free areas. It's also there considered to be the responsibility of the government to make sure that FMD stays out of the country. Yes. So what are the opportunities? Opportunities for private investment by farmers' communities. So the very important first opportunity would be they would be able to secure their herd from infection if they vaccinate, if they take the responsibility to have a vaccination program on their farm. Animals will remain healthy and will not get sick, will not die, no losses. That's the first thing. But at the same time, they can induce a safe movement of animals. Animals would be able to buy safe animals onto their farm and ensure that no infection is introduced. Further on, and that's a more economic further on into a cooperative context, farmers would be able to guarantee that their products and their animals are free from foot-and-mouth disease and would be able to even export products to neighboring countries, and that would be give a very high return of investment. The fact that the private sector invests in FMD control is also a good is also an added value for the public sector, because if more farmers would take the initiative to vaccinate animals for the government, it would increase the coverage of a vaccination campaign, and in the long run they would be able to progress on the PCP, on the progressive control pathway. So the private sector investing in FMD control would be a win-win for both public and private sectors. But there's a number of barriers, and this is a slide which is provided by which was provided by Jeremiah Karuga. He did a webinar a few weeks ago on the PCP network of the EuFMD on public-private partnership, and he clearly stated a number of barriers which are in place for a number of stakeholders here. For the manufacturer, it's as was said just before the coffee break, so there's a lack of market information for producing and for investing in vaccine production. The distributors also have an uncertain demand coming from farmers and from veterinarians. Wholesalers have a lack of infrastructure, cold chain. Also the agro shops, and at the end of the arrow, vets and farmers are sometimes unwilling to report and to report outbreaks and to ask for support from health services to assure that their farms are free from disease. There's a willingness to pay by farmers. This is a question which I've asked for another project to the Uganda Farmers Federation. And they said farmers are willing to pay, but the first criteria for that is that it requires a value chain. So there's a return of investment. Farmers should be able to value their investment. It has to be, of course, at affordable rates and in line with the available resources that a farmer has. And it depends on the needs and the costs, and the needs are not always very clear. So farmers are not always aware of the risk of foot-and-mouth disease, and therefore awareness raising and training is very important. This is an example from the Ugandan meat producer cooperative. It's a large cooperative. They want to produce high-quality meat and meat products for local and international markets. So they intend to, and they do, export Ugandan beef to neighboring countries, and therefore they have to guarantee a level of safety. And they buy animals from smallholders and put them into feedlots, and from the feedlots they export. So they have to make sure that the animals they buy from smallholders have a sufficient quality and a sufficient health status. And for that they are willing to invest in health services, in diagnostics, indication to make sure that the animals they buy, so they buy from smallholders, are actually good enough to be exported and to be traded. And therefore, from them, there's a high demand of having access to vaccine to be able to vaccinate animals within their corporation. There's a number of challenges. If we want to get to a private-public partnership, it has been said before, we need an access to high-quality vaccines. We have to develop a sustainable business model with education. And often programs which are giving out free vaccine by governments actually can disengage local veterinarians and give animal owners sometimes the feeling of being forced into something mysterious, something funny. And so they don't always understand why they have to vaccinate for the mouth disease. And so also the diagnostics part is very crucial. Countries and sectors have to be able to test animals to be able to show they are free and to be able to be traded. What can be a strategy? This is from proposed by the people I consulted. The important strategy is to have an open discussion between the public and the private sector and to identify issues together, identify solutions, and to identify priorities to have a public-private collaboration. And so, and with that, the veterinary service have to be engaged to the discussion. And we see that the OIE has taken an initiative in 2016, the OIE Public-Private Progress Initiative, where they try to deliver guidance and support to veterinary service on promoting sustainable public-private partnerships. And this is a very good initiative. Very closely. And as an end, I would like to also highlight the discussion which is ongoing on the EuFMD network, the Progressive Control Practitioners Network, where there's several presentations available on the opportunities for creating public and private partnerships for vaccinating animals and also for other reasons, which can be found by clicking on this link, and you're all invited to join that network if you haven't done so already. And I want to close. Thank you very much. Sorry for the time.